Good evening, everyone. I'm Laurie Ledley from Valley Sleep Center. Thank you so much for joining us tonight for our CBD webinar with Dr. Paul Lynch. Welcome, Dr. Paul. We are so excited to see you. Can't wait to hear what you have to teach us all about CBD.
Hey, Laurie, thanks for having me. Can you see me talking? My face looks frozen on the screen.
I can see you. You look perfect.
Okay,
You look 40. You look 40.
Thank you so much for having me today. And thank you to all the people that signed up. I put this on our chronic pain support group on Facebook as well. And I think some of you guys joined. So I appreciate it. It's nice kind of seeing you. We're today going to talk about CBD. And I wanted to give you guys just a little bit of background. We did a nice talk this week on COVID. And tonight we're getting into more like holistic medicine, which gets me very excited. I want to give you like a 2-minute background, and then I'm actually going to show you a couple of videos. And Laurie, I think this is just a great use of everyone's time. I'm going to show a compilation that I put together, one on a patient that CBD helped them with seizures, and one that a patient was helped from CBD with Parkinson's disease. And then a really interesting lady who doesn't feel pain ever, because she has a molecule in her body called Anandamide that acts like CBD, and she's got like twice as much as normal people, and she never feels pain. And then I'm even at the end going to show just a few minutes of a video of my own son who has a severe seizure disorder. I'm going to run the video because the original video is about 18 to 20 minutes long, and it's just too long. And I'm going to show you guys about 10 minutes. And then I'm going to come back and talk about what you saw in those videos and the science behind CBD, which is a lot better than people realize. Anytime something's controversial, you know, it kind of polarizes people. And I'll just tell you guys today, CBD is not really controversial. Marijuana is controversial, but CBD is not. And what we're going to do with our patients starting this year is we have come up with a molecule that will treat their pain and anxiety and sleep and focus, but it doesn't come from marijuana. So it really is not controversial at all. We're actually producing CBD from orange peels. Laurie, did I explain that to you, that we're using oranges?
I heard that. I'm so excited to hear more.
What's cool about it is it takes away any of the salaciousness of it, or the controversy, or someone that says, "Well, I go to church. What would my pastor think?" Well, your pastor will be fine with this. We're actually making CBD in a lab, the identical molecule. It's identical, and we're doing it from oranges. So unless you're just like against oranges, this shouldn't be too controversial. But before we get into all that, I'm going to show 10 minutes of videos. You think that's too long, or is that okay?
No, I think it's great.
Okay, so guys, I'm going to show you 10 minutes. The last one is my own son. So if I come back and I'm having a hard time talking, honestly, every time I watch it, it kind of makes me tear up. We've been dealing with this a long time. My son developed a severe seizure disorder at age like 3 or 4 and stopped talking, was nonverbal for a long, long time. And CBD has been part of the treatment that's helped him start to talk again. And so for me, this is a very kind of personal journey. But let me just show you these 4 patients, one that has Parkinson's, one that doesn't feel pain, that I'll explain more. And then Charlotte Figge, who CBD's helped her stop seizing. And then I'll show you just a little bit about my own son. So here we go.
Hello, my name is Jill, and I have Parkinson's disease. I'm taking my Parkinson's prescription medication this morning, and this is how it helps, and it doesn't. This is my oil, cannabis oil, and I'm just going to spread it on the biscuit like that.
Laurie, can you hear it?
Since I've had that.
Yeah.
Okay, good.
The biscuit, and I feel wonderful. No shakes, no nothing.
Jo Cameron is a 71-year-old Scottish woman who has never felt pain or anxiety. Scientists were fascinated by her story and set out to understand how this could be. What they found was that Jo had a genetic mutation that caused a dysfunction in one of her enzymes. This enzyme was FAAH, which is responsible for the breakdown of anandamide, the bliss molecule. Because of Joe's enzyme failure, anandamide builds up to high levels in her brain, and she never feels pain or anxiety. CBD works on exactly the same receptors as anandamide.
I only know this in retrospect because I didn't realize at the time, but breaking my arm at the age of 8 and not realizing it until my mother, 2 days later, my mother found that my arm was a peculiar color and a peculiar shape. Having a huge baked potato burst in my face and not realizing that I'd done much damage. Backpacking in Eastern Europe, tripping over with a rucksack on my back and falling into a concrete bollard and losing my front teeth and damaging my face and not feeling any pain with that. I felt stupid and looked awful, but I didn't feel any pain. Childbirth. I just went through childbirth expecting to feel pain.
Wow.
In my head saying, when it gets painful, whatever pain is, whenever it's painful, I'll ask for it. The painkiller, but didn't need it. After my hand operations, I didn't have any painkillers then when I was told it would be extremely painful. And lots of minor things. I burned myself, I cut myself. And I just thought I was incredibly clumsy. And then this is going to sound stupid, but when we're gardening, I love pulling up nettles, stinging nettles. I love the feeling in my hands. It's a tickly feeling in my hand. And it's a joke now, but I don't wear garden gloves because I enjoy that feeling. Everyday things, I'm ironing, and quite often I'm sort of ironing away and suddenly find I've ironed my arm. And it's only when I see after there's a sort of mark down there that I realize I've ironed my arm. So just everyday things that are just, but they're normal to me, you see, so they don't seem strange. It's how I've always been. It's only when people point out it might be peculiar that I realize I am peculiar.
We are remembering and honoring 13-year-old Charlotte Figge. She passed away Tuesday after a long battle with a rare form of epilepsy. She became a symbol of the possibilities of medical marijuana after our own Dr. Sanjay Gupta shared her story in his documentary, Weed, and he has more on her life.
For the last 20 years, I have straddled the world of medicine and journalism. And in both professions, I'm always reminded, stay objective, do your best work, but don't get too close. But with little Charlotte Figge, that was impossible. She just had this way about her, that smile, that giggle, that just got you and captured your heart. You remember me? That was June 2019, the last time I saw Charlotte. Oh, wait, and she was doing great.
Looking pretty good, sweetheart.
I can't imagine back then, she'd be 12 years old and seeing her at 12 years old and what that would look like. She was dying.
Really well.
When I first met Charlotte, it was 2013 for our first film on medical marijuana called Weed.
Pitter patter, pitter pat, tiptoe, creep crawls in the cave.
We had heard about this amazing 6-year-old from Colorado who had a rare form of epilepsy. She had a seizure every 30 minutes, every one potentially fatal. No treatment had worked. And then one day, desperate, her parents gave her a non-psychoactive ingredient from the cannabis plant called cannabidiol, or CBD.
This is Charlotte's web. She didn't have a seizure that day. And then she didn't have a seizure that night.
Did you sit there and
put
your watch?
Right. I thought, this is crazy.
And it was at that moment, people started to see that marijuana, which had been considered dangerous, could also be a therapy. She changed my mind and opened my eyes to the possibility that this was a legitimate medicine. And in the process, she changed the world.
Probably the most important thing I'll ever do was to help my own child and then share that information and help others.
Charlotte Figge was the entire CBD movement wrapped up into a sweet little girl with a big smile and an even bigger heart. Her story changed policy about cannabis. States were inspired by the story of Charlotte Figge and made CBD more accessible around the United States to treat epilepsy. And in turn, scientists around the world wanted to study Charlotte's special CBD oil, research that before Charlotte, no one really seemed that interested in doing.
I was begging researchers and physicians to work with us and help us understand the phenomenon that we were seeing, and they absolutely wouldn't even talk to us. We were laughed out of rooms. Now they beg to research our product.
She's kind of being outside and this is her jam.
Charlotte lived her short life to the fullest. And while she was almost this mythical miracle, she was also just a little girl who loved to go tandem biking with her mom. And while the last month was not easy, she had symptoms of COVID-19 while never testing positive. She eventually developed pneumonia, which once again unleashed her seizures. Her mother, Paige, says Charlotte was still smiling and happy until the very end, when a seizure became more than her fragile little body could handle. Charlotte's life ended just as it began, in her mother's arms, surrounded by family who loved her, cherished her, and protected her. All forever changed by this little girl who forever changed the world, and everyone, like me, who were caught in her glorious orbit. Please rest in peace, Charlie.
Can you just tell us a little bit more about her and the impact that I'm sorry, Sanjay, and the impact that she had on the world?
You okay, Austin? What's wrong? What's wrong? Are you okay? No. See you later, Austin. Hey, can you say hi, Daddy? All right, I'll see you later. Hey, can you say hi, Daddy?
Hi, Dad. See you later.
What's your name? Hey, what's your name?
What do you say? What do you see?
Do you know what your name is? Can you say Austin? Say Austin. Are you Austin?
I will.
Yeah, you're Austin. Who's this? Hey, who's this?
This.
Who's this lady?
Later.
Do you know who it is?
What's my name?
Can you say mommy?
No.
Look at her. Look at her. Come on.
Can I see your eyes? Can I see your eyes, Austin?
Look at her. Look at her. Say hi, mommy.
Hi, Daddy.
No, look at her. Look at her. Say hi, mommy.
Hi, Mommy.
Now look at her.
Gotta give her
Say
eyes.
hi. Give her eyes. Say hi, mommy.
Hi, Mommy.
Hey, buddy.
Hey, dude. Hey, guys. Hey, guys.
Hey,
It's nice to see you.
It's nice to see you.
Believe in him and believe in me. Together we will fly away in a cloud of green to your beautiful destiny. As we soared above the town that never loved me, I realized I finally had a family.
Okay.
Wow.
So
I'm glad my video's broken.
so it's kind
Wow.
of hard for me to talk over that, but it's all in probably about I guess, 15 minutes. I just wanted to show you guys parts of it. I'm going to start my presentation now, but I wanted to give you guys that as a background so that we kind of level set the discussions. And I think in my experience as a doc, drawing attention to individual stories sometimes can be more powerful. And it's hard for me, sharing my own son's story. I think just to be clear, Charlotte Figge, who you saw, she really started an entire revolution, and she helped my son. So when we read about her story, we put my son on CBD. And I don't want to mislead anyone. CBD didn't just completely change his life and make him normal again, but it's certainly been part of the story of helping him talk again. And that's just what's incredible. He's still very, very sick, but he is talking, not a lot, but some, and that's, pretty powerful. And so I'm super thankful for Charlotte, and it's really sad that she passed away this year or last year. I'm just going to spend about 10 more minutes, Lori. I only have 13 slides, but I want to go over at a very high level why I'm interested in CBD beyond just my own son's story, why I think the science works. And it's not that I think it works. The science does work. There are really large randomized controlled trials showing that CBD works for things from everything from rheumatoid arthritis to neuropathic pain to sleep, anxiety, and focus. So why does it work? That's the real question.
Sorry to interrupt you.
Yeah.
I still see your beautiful family on the screen. So could you share the other screen?
Yes, thank you so much.
You're welcome.
So I'm going to say stop share.
And
then
take your time. I'm sure I'm just respecting your time. So whatever time you have to give us, we appreciate it so much. What a powerful story. Thanks for sharing that. Yeah, now I can see it. Perfect.
Okay. So for those who don't know, I'm Paul Lynch. I'm a pain management doctor. I'm an anesthesiologist and interventional pain doc. I've been here in the Valley this will be year 14 years. And we have a lot of patients that are in pain. My best friend is Tori McJunkin, and also a business partner. We started the practice together. And what's really cool about our background, just so you guys understand some of this, is his dad's a naturopath and my dad is a behavioral therapist. And so we look at pain, I think, a little bit differently, where we're looking for other alternative ways to help people with pain. My dad tries to help people with pain with their mind, things like biofeedback and cognitive behavioral therapy. And Tori's dad is a naturopath and has all sorts of natural solutions for pain, including acupuncture. We actually approached Tori's dad years ago about, are there natural treatments for pain that could make sense? And way back in 2010, we launched a company called Holistic Pain. And our idea was that at that time, for every diagnosis that came through the door, that we would have a natural solution. So we would have a natural solution for an anti-inflammatory. We'd have a natural solution for neuropathic pain, et cetera, et cetera. And just with everything else that goes on in life, we kind of just let it sit on the shelf. We treated a few patients here and there, but we never really pushed it or talked about it. And that kind of changed for me as I went through this path with my own son and found my son had a severe seizure disorder. When he sleeps at night, he seizes 80% of the time, 80% of the time. And so as I was going through this kind of journey with him, we found out about the story with Charlotte Figge. And I started my son on CBD as well. And he also started to improve. And so I'm not going to bore you with all the details, but just to say, we went back to Holistic Pain and said, what if we included CBD in these products? And our first question was, well, does CBD work? Because we don't want to just do it just because it's a hot, sexy topic. I told Tori for sure in my own anecdotal experience with my son, it works. But we really wanted to research. And so as we looked into it, what we found is the data was incredible. And so what I want to do, I just want to share with you what CBD is, how it works, why it works, and the data. And then I'm going to take as many questions as we have time for. So we have a system in our body called the endocannabinoid system. And if I ask around to doctors, probably half of doctors have never heard of this. That's what's so crazy. It's real, it's evidence-based, it's been researched extensively. But the reason doctors don't know about it is we first discovered it only about 30 years ago. So like the vascular system or circulatory system was first described, I think in like the 1500s, way back in the Middle Ages. This was the most recent system that we discovered, and it's in the body, it's in the spinal cord and the brain and throughout the body. And it helps with things like pain, sleep, mood, inflammation, metabolism. It's incredibly complex and we're still learning about it. But what we found out is that there are two types of cannabinoids. There's what's called an endocannabinoid, and there's a phytocannabinoid. So when you hear about CBD and marijuana and THC, that's a phytocannabinoid. It's a cannabinoid from an exogenous source from a plant, and it includes things like CBD, THC. There's actually more, things like CBN, CBC, CBG. I'll show you in a slide or so. There's between like 80 and 140 different phytocannabinoids. But there's also endocannabinoids, and these are naturally occurring cannabinoids in your body. There's 3 that we know of so far. One's 2-AG and 2-AG ether, but the most famous one is Anandamide. And you heard that lady talking in the video. I think she was a little bit clumsy also, by the way. She's like ironing her arm, but she has about twice as much Anandamide circulating in her brain because her enzyme doesn't work right, and so it builds up. And because she has all this Anandamide, they call Anandamide the bliss molecule. And so she feels happy all the time and doesn't feel anxious and doesn't feel pain. And scientists, when they see stuff like that, they say, why is this happening? And so as they studied her, she actually helped us understand more about endocannabinoids just in her story. So what is cannabis sativa? Depending on who you are, you may think this is an evil plant or this is a great plant. It's very controversial. I said that at the beginning. It has THC, it's marijuana. And THC can be mind altering. It's a psychoactive plant, and of course can be abused. But cannabis is not just marijuana. Cannabis also has hemp, and hemp means it's basically a version of cannabis that has very, very, very low THC. By definition, by our federal government, it has to have less than 0.3% THC to be called hemp. But really, it's just all the same plant. Think of it as like people. There's tall people and short people, skinny people, fat people. That's cannabis. Hemp and marijuana are just basically 2 versions of the exact same plant. They're the same species. Everything is the same. The only thing that's different is how much THC they have. And that's not completely true. The hemp plant is a very robust plant that's been used in textiles for hundreds of years. But the bottom line is it's the same genus species. One just doesn't have any THC in it. And that version of it, we have found out in medicine, we can use for all sorts of treatments, things like seizures, anxiety, pain, sleep, and focus. I'm going to talk about that, the data here in a minute. So what's the difference between CBD and THC? Lori, I bet you don't know this. Did you know that CBD and THC have an identical molecular formula? It's exactly the same.
What? No, I didn't know that.
The reason I say I bet you didn't know it, because everyone that I've asked, no one knows that. It's the same exact molecule. It's C21H30O2. But the way it arranges, the way one folds a little bit and one sticks out a little bit differently, the way it arranges makes one incredibly psychoactive, the way it hits your brain and can make you, feel crazy. I want to make jokes, but I'm not good at it. And then one instead regulates your system, takes away anxiety, and helps pain. It's just crazy. There are 80 to 140 different cannabinoids that have been identified so far. We think that number will be over 200 over the next decade as more and more people research it. And so here's the most exciting thing I'm going to say on this slide. Just in the last 10 years, we found out that we can actually make CBD in a lab from yeast, bacteria, algae, sugar, citrus peels. There's probably 4 or 5 different ways you can make it. And one way for pain patients kind of understand this, the way I would think about it is like opium was the original pain-killing molecule. It came from a flower. And then they made morphine many, many years ago, which took the opium and made morphine. And then they made hydrocodone and oxycodone and methadone and fentanyl. And all the medications that we use these days are actually synthetically made in the lab, but it works exactly on the same receptor, the mu receptor in your brain, the same way that opium was hitting that receptor, so does Percocet. It's the same exact idea here. We can make that exact molecule on the left side of the screen here, identically, that's going to hit the molecules in your brain from oranges. And once we do that, now we remove the controversy. Now it's not an issue of, oh, we're taking marijuana and treating people. And while I kind of like the idea, I don't like marijuana. Now it's, we're taking oranges and treating people. I just want to stop. Lori, do you have any questions about that? Because that's kind of a crazy concept. I just want to stop there to see if you had a question.
I'm just fascinated. Keep going. I love it. This is
so
great.
We identified this company this year. And for me, that was the turning point. I knew that I've been wanting to use this, but as a pain management doctor, there's so much stigma about marijuana. Just to review for people, marijuana is federally illegal. According to the FDA, the DEA, it's considered a Schedule I drug. So our federal government says that marijuana has no confirmed medical use, which we know is total crap. It's not true, but that's the way the federal government has chosen to schedule it. And because they've done that, doctors like me have a really hard time ever talking about marijuana as a treatment because the government says it's totally illegal. They look at marijuana and heroin identically. Even cocaine, Lori, I don't know if you know this, even cocaine is Schedule II, which means we have a medical use for it. We use it in the operating room for sinus surgery. Were you aware of that?
Yeah. No, I was actually. I didn't know that. So interesting, right?
And when we were in the OR, we used to have all the good stuff in the back, we would say. And so cocaine is a Schedule II drug, but marijuana is a Schedule I drug. A lot of doctors just think it's a little bit ridiculous, but that's the system we're in. But because there was all this controversy, I found out just this year that we can make CBD from oranges, and we went all in. We found a partner, and we figured out a way to start making this so we could give it to our patients without ever having them be positive on a urine drug test. I want to make that really clear. If you take a CBD product that's made from something like oranges or sugar or bacteria, you're never going to show up positive on a urine drug test because it's testing for THC, not for CBD. So let's talk about cannabidiol. It does not have psychoactive effects of THC, not at all. It has a very regulating homeostatic effect. Both the World Health Organization and the FDA have designated CBD as safe for human consumption. That's a really key point. They've come out with statements saying all the data they've looked at says that it's safe. There are no documented adverse events, including addiction, and there's no evidence of psycho or physical impairment. And this is where it gets exciting. CBD has been noted to have analgesic properties, anti-inflammatory properties, anti-anxiety properties, antipsychotic, and even anticonvulsant properties. So this molecule is really incredible. And there's going to be so much research on it over the next 10 years. So I just want to tease it, tell you what I'm going to say, and then I'm going to say it. The data shows that CBD helps with seizures, chronic pain, neuropathic pain, rheumatoid arthritis, sleep, anxiety. That's the things I'm going to go over here real quickly, and then I'm going to take questions. So seizures. And the reason we have all this good data, by the way, just to be clear, is there are 2 drugs in the world that have now been approved for use that are CBD. And they're both approved for use for seizures, like my son has. And so when they were going through the process to get approval, they tracked all these patients and they were able to see effects on other disease states. So we got all this data because 2 companies, one Epidoleyx and the other Sativa, did these studies. Just as a baseline, Epidoleyx is the only product in the United States that's approved by our FDA, and it's for seizures, and it has 100% CBD. Sativa, on the other hand, is not approved in the United States because of the controversy around THC. It is approved in the United Kingdom. And what's interesting about Sativa is it's a full spectrum product. And what that means is it has CBD and THC. And so it's not approved here, but it's approved in the UK. And so when you hear me talk about Epidoleyx, that's an American product that's only CBD. And when you hear me say Sativa, that's a United Kingdom product that's both CBD and THC. I'm almost done. Seizures. There have been 4 randomized double-blind clinical trials that have shown an absolute reduction in seizure frequency with the use of Epidoleyx. That's an American product. Epidoleyx has revolutionized the treatment of medically refractory seizures for patients with Dravet syndrome and Lennox-Gastaut syndrome. That probably the best data is on seizures. It's where we first found out that CBD was helping, and it was the story you saw with Charlotte. It also works really well for chronic pain. I think a lot of my patients will be happy to hear this. There have been 18 trials, and 15 of the 18 randomized trials showed that CBD helps for chronic pain. 15 out of 18 trials. They showed significant analgesic effects of cannabinoids as compared to placebo, and several reported significant improvement in sleep as well, which I'll get to in a second. There were no serious adverse effects noted. That's what I get so excited about. When I talk to a patient about anti-inflammatories like ibuprofen, I talk to them about GI bleeding and kidney disorder and all these issues with ibuprofen. And if I talk to them about Celebrex, I say, well, it's good, but it could also have an effect on your heart. And when I talk to them about Neurontin, I say, well, there could be dizziness and weight gain. There were no adverse effects reported in these trials with CBD, which is just absolutely incredible. Overall, evidence that cannabinoids are safe. Overall, the evidence shows that cannabinoids are safe and modestly effective for the treatment of neuropathic pain, with preliminary evidence for efficacy for fibromyalgia and rheumatoid arthritis. I'm going to get to that in a second. In studies of generalized pain, CBD correlates with consistent improvement in patient-reported quality of life and quality of sleep. In one mixed cohort study, CBD treatment significantly reduced pain on a VAS. So for neuropathic pain, this is Sativex data. they showed that in a randomized double-blind study, this is the gold standard of research, Sativex was noted to reduce mean pain scores as compared to placebo. Additionally, Sativex correlated with improved sleep and reduced allodynia scores as compared to placebo. When we say allodynia, that's like the hypersensitive pain from like CRPS or nerve-based pain. And Sativex, keep in mind, Sativex it has THC and CBD, full spectrum product, but the data was very, very good. By the way, some of this data with Sativex can be a little confusing, but the data, we believe that most of the healing properties come from the CBD, not the THC. THC just kind of makes you feel good, but the CBD is the one that makes you sleep better, have better focus, less anxiety, and less pain, and certainly less seizures. The data on rheumatoid arthritis is pretty good. One study with Sativex noted significant analgesic effect and disease activity was significantly reduced. So not just pain, but they showed the disease burden went down with less inflammation. And once again, in these large studies, no serious adverse events were reported. CBD possesses anti-arthritic activity and might ameliorate arthritis via targeting synovial fibroblasts under inflammatory conditions. So this gets into the science, but they were looking under microscopes and looking at the tissues and showing it was actually changing the cells, which is just so crazy for us that we didn't even know about this system 30 years ago. And it might help with things like rheumatoid arthritis and some of these other conditions. You'll like this, Lori. CBD, the data shows, helps with sleep. Review of data from the Sativex trial combined with 2,000 subjects demonstrated marked improvement in subjective sleep patterns in patients with a wide variety of pain conditions, including multiple sclerosis, peripheral neuropathic pain, intractable cancer pain, and rheumatoid arthritis, which we already discussed. And once again, very few side effects, if any. And then anxiety. A lot of my patients have anxiety. There's great data for anxiety and CBD. In a large randomized double-blind study, CBD was noted to show significantly reduced anxiety, cognitive impairment, and even discomfort in speech performance in simulated public speaking situations for individuals with social phobia. So when you look at the whole thing, the 4 big things that I'm telling patients it's going to help for is pain, sleep, anxiety, and then focus. I didn't put focus on here. I'm sorry, Lori, but many people are taking CBD now almost like for ADD or for better focus. And what's interesting about it, and this is kind of my final slide. This is, by the way, our product. We're not going to be out for about 30 days, but we're going to have this for our patients. It's a tincture that goes under your tongue. And we're not just going to do CBD because we had a long history of holistic pain having different formulations. We're actually going to add other pain qualities to it, like vitamin D and vitamin K and some other natural anti-inflammatories, but you'll put it under your tongue and it gets taken up. And what I recommend to most patients is, Lori, you'll like this, is to take it at night. Take it about an hour before you go to sleep, and it's going to help you sleep. We've been actually tracking the sleep patterns of a lot of our staff, and before and after, we'll see a huge increase in their sleep and even their REM cycles, and then they feel better when they wake up. So
awesome.
I talked for a long time there.
Okay.
But I hope that was helpful.
It was so helpful. I have a few questions.
Yeah.
How long does it take for a patient to notice effects from this new product that you have from the CBD?
Yeah, the data shows that you need to take it consistently for about 6 weeks to get like a blood level. But a lot of people, especially on sleep, will notice an effect like the first night because it has just like a calming effect. But for the best results, it's about 6 weeks. It's kind of like an antidepressant. If your doctor ever started you on an antidepressant, they'll tell you, give it about 6 weeks to really change the levels of neurotransmitters in your brain. And the thing about CBD is we call it a neuromodulator. So it's like a neurotransmitter, but it's different. It's actually going to work on the same synapse where like dopamine would hit, and it's going to modulate the activity. And so give it like 6 weeks. That's
so awesome. Can it be safely used with other drugs? Like if I was a patient and I came in and I'm on, Cymbalta and maybe a muscle relaxant, things like that. Like, would you feel safe giving that to me to help me wean off of those things? Like how does that work?
It's not going to interact with other medications. So there have been large randomized controlled trials, and there just were there's like no effects or bad effects from the CBD. It's a natural molecule. It's already in your body. And so, we're not worried at all about mixing it. What I'm excited about is to start patients on this instead of some of these other meds. If you look at the research on CBD, about 40% of people that try it they go to it exclusively and they stop using all their other meds. So 40%, I'm hoping that's what happens in our practice, that we get some patients off of these medications that have bad side effects.
So do we need to be a pain patient in your practice to be able to get this drug? I'm not drug, sorry, this product drug.
No, not at all. And I just, this is a very early seminar because you asked me to talk on it. I love teaching. So we're probably going to release the product in about 30 days. You'll be able to get it on holisticpain.com as our website. It's easy to remember, holisticpain.com. And you can order it right on there. And our patients, we're going to do everything we can to make this really affordable for our patients. We're actually going to have like 4 or 5 different incentive programs, our rebate programs. So healthcare workers, we're going to make it cheaper for them. We're going to make it cheaper for veterans, the disabled. We're going to have really nice discounts for anyone who's disabled or has low income. And we're even going to have an Arizona pain discount because it's our patients, and we want to make it where anyone that wants to get it can try it.
And do you have any idea what the cost will be?
We're working on it right now. I will just tell you, it is a very expensive molecule to make it from oranges. And so the price point probably is going to be around $100, but we're going to try to discount that for patients so that they can afford it. But it is a fairly expensive molecule to make. For example, the product that my son is on is Charlotte's Web from the story you saw on Charlotte. And his product costs $120 a month. We're going to have the same amount of CBD in there as they have, plus some other molecules, and we're making it in a lab, which makes it a whole lot more expensive, but we're going to still try to beat their price. But that just gives you a little bit of the lay of the land. It can be very expensive. And I'll just say that if you go on Amazon, I don't think even sells CBD, but if you go online and try to buy it, you'll see a lot of people that will sell CBD for like $50 or $70, but they're giving you a very tiny dose. The average dose that you'll see online is 10 milligrams a day. And they're giving it to you in pill form, which gets broken down about 70%. We're doing a pure tincture under the tongue, and instead of 10 milligrams, we're doing 60. So our dose is the highest available on the market, and we're still coming to market at a fairly good price. We actually looked at the top 30 products, and the average cost of CBD per milligram was about 15 cents per milligram, and we're coming in at 5 cents.
That's great. Well, I will make sure that I follow up with everybody with an email with holisticpain.com. I think it would be really great to do another community health talk in like 6 months.
Lori, I just want to interrupt.
Yeah.
Were there any other questions, or I just want to make sure everyone knew? If you have a question, you can go in the chat because
they did. Let's see. There's a lot. Like any interactions with meds, we talked about that. We talked about drug testing. You would not test positive on a drug test at all. Do you have to be a patient? I went through all the questions.
Okay.
Sleep apnea. Can people with sleep apnea use CBD to help improve sleep?
For sure.
Yeah.
The data on sleep is really good. It's going to help your sleep architecture. It's going to help you have more healthy REM cycles. And it's going to make you feel more refreshed. So absolutely.
Yeah. And we don't need a medical marijuana card. I think we answered them all.
Yeah. So you don't need a medical marijuana card because it's from oranges. It has no THC. And then I actually saw a question at the top that we missed that said, if someone takes CBD with no THC, why is there still a chance for a positive THC? It's because most of the products that you see advertised, 99% of the products that you see advertised, they're taking the hemp plant, right? And hemp is 0.3% THC. It's not zero. And these companies will try to titrate out or mix out all the THC, but sometimes they don't. And they send you a molecule and they say that it's not THC, but it is. Matter of fact, the Journal of the American Medical Association, JAMA, did a study and showed that 58% of CBD molecules were mislabeled. So they're lying to you about what's in it. And so it makes it really scary. A patient goes and buys it and then they test positive. I had 2 people reach out to me on social media today saying they got in trouble because they were on a no THC product and then they tested positive. So our product just doesn't ever have any THC ever, ever, ever. It's just CBD. We make it from oranges.
What's the difference between tincture and gummies?
Yeah, gummies you're going to chew up and it's going to go in your stomach and it's going to digest. And then you have what's called the first pass liver effect. And so it's going to reduce the amount of CBD by 70%. The tincture, the way you ideally take it, and I don't think the FDA really allows me to say this, but the theory behind it is you put it under your tongue and you let it be taken up that way. And so probably the way it really happens is even as it coats your mucosa, as it goes down the esophagus, it's going to be taken up directly across the cells. And so it's going to be more powerful.
Well, I'm really excited. I think we should do another CHT in 6 months with stories. People's
yeah.
with it. I'm excited. I want to be the first one to get it.
We'll send you some. I've actually got some samples I'll send over to you.
All right. Fantastic. Thank you everyone for joining us, and have a beautiful evening. Thank you, Dr. Lynch, for having 2 talks with us this week. We're so blessed to have you.
Thank you guys. God bless. Bye-bye.
Right, bye-bye.